the story a bit further. Now, Union Nehawu is claiming victory, saying the Gauteng Health Department has finally agreed to pay the bonuses. Nehawu says the date of payment will be decided on at a meeting on Tuesday. Let's discuss this further. We are now joined by Nehawu's Deputy Secretary in Gauteng, Gracia Rikhotso. Thank you so much for coming through, Gracia. So it seems now your issues have been resolved. Where do we stand at the moment?
Okay, thank you once again for providing us an opportunity to take the Gauteng community into confidence in relation to the state of affairs at Charlotte Maxeke and other neighboring hospitals within Gauteng. The current status is that we met with management this morning at 9 o'clock, and this was a long scheduled meeting, not necessarily activated by the violence that actually erupted. But further to that, it was a necessary meeting because this is one of those long outstanding meetings that should have actually taken place. And we want to thank the hospital management to coming to the platform and afford us an opportunity to engage on this long outstanding issue. In relation to the process, we have agreed and received a commitment from the department to honor the payment of 2016-2017 performance bonuses. And in terms of the payment process, we could not proceed in signing the agreement this morning or even later this afternoon because there were two issues that we needed to obviously clean out in terms of the proposed agreement that was tabled.
What are those two issues? The
two issues are emanating from the numbers in terms of the total employees who qualified to be paid bonuses, because there are two levels in terms of how the bonuses will be paid. There are those employees who have scored a score of 4, and there are those employees who have been scored as outstanding performers and they registered a score of 5. What was not clear in the agreement that was tabled today, it is the figures in terms of what is the total employees who falls on that category of the score of 4 and what is the total number of the 5.
So it's a matter of just, dotting the I's and crossing the T's.
That's correct.
Before you see that money in your bank accounts. And that's great. But however, there's this issue that has sort of overshadowed your protest. Health Minister Motsoaledi yesterday describing it as hooliganism and even suggesting that if you interrupt the workings in theatre and you actually try to interfere with a doctor who's holding a newborn baby, you could be possibly a murderer. We see the trashing of the hospital, which is also a problematic thing. But interfering with the working of healthcare workers, surely you didn't have to go that far?
We want to firstly just give the briefing just like we did this morning to say, as a union, we were not on the premises when the trashing happened and the alleged disturbances in the theatre area. What we did when this issue came to our attention, we then rushed to the hospital. By the time we got to the hospital, there was already intervention from the police in terms of opening the gates. But the interaction that we've had with employees at the hospital could not give us a clear indication in terms of that particular allegation of the disruption at the
Gracia, I'm sorry, it's not an allegation, it's out there. We're seeing the visuals, we're seeing the pictures, we have been to the hospital ourselves, we saw the disruption that took place. It's not an allegation.
Tula Sizwe, I think you need to allow me to finish in terms of why are we saying that it is an allegation. The reason that we're calling it an allegation, you would also appreciate the fact that we also had to conduct or to interview people who were there at that point. And it doesn't actually come out clear insofar as the theatre incident. And as joint unions, we have made an undertaking to say we'll have to also institute the processes of going through that, because what we did, we took the responsibility and we apologized, because disruption, be it's in theatre or it's at the gate, it is a disruption, because a hospital, it's an area where people come for assistance in terms of medical intervention. Secondly, we have also made a commitment to say we are going to work and cooperate first with the MEC, secondly with the CEO of the hospital and the minister in terms of identifying the culprits, and if indeed it points at the direction that there were disruptions in theatre, we'll have to obviously take a constructive position.
So if you're denying the disruptions in theatre, what are you taking responsibility for and what are you apologizing for?
Yeah, let me just put it categorically. We are aware that the hospital was trashed. We are aware that the hospital gates were actually locked. Thirdly, we are aware about the fact that our members moved from where they were actually picketing for the previous 2 days into the hospital itself. And we have obviously learned in terms of what happened in the pharmacy area that there were indeed disturbances. Those are the...
And that's not a small matter.
It
Gracia.
definitely not.
The pharmacy issue,
It's
because
definitely
the
not.
allegation goes that people were turned back who were supposed to be getting their medication, including people who possibly are on chronic medication. That's a big thing.
What we have actually learned from the manager in the pharmacy area was that there was an intervention and patients themselves did not actually leave the hospital. So we need to verify that, because we had spoken to the manager in the pharmacy and no person was actually turned back because the manager intervened and ensured that patients got their medication.
All right, let me ask you a question then. Your fellow organization, DINOSA, has come out and said, given everything that we have seen in various parts of the country in the health sector, life as it demeni, the oncology crisis in KZN, the situation in Gauteng, it's time for Health Minister Aaron Motsoaledi to go. Do you share that sentiment?
Not at the moment, because we need to be informed by facts. We are working very closely with the minister around the NHI. And in terms of the work and the progress that has been registered around NHI, we are confident that the minister is handling that process well. We are having report backs with the minister in terms of how far that process, because NHI, it's the baby of Nehawu. We are the people who are very vocal within the COSATU unions and actually called for the implementation of the national health insurance. So we do actually support the minister. We believe that the process is actually on a point where, in terms of the time frames, it is actually...
so should Dr. Gwen Ramokgopa, the health MEC, take political responsibility for it and go?
We need to actually state it in terms of the period that the MEC has been in the Department of Health, considering that she has inherited a department that was dysfunctional. As organized labor, we have collectively agreed that we need to actually work closely with the MEC. We have agreed in terms of a series of meetings that must take place, because we cannot be a bystander, but we still have a responsibility to support the minister up to a point where we would actually say she has actually done it or she has failed.
Gracia Rikhotso, thank you so much for coming through. She is from Nehawu here in Gauteng.